The understanding is now evolving that, how not to inject too much in a person's face over a period of time, because that's when people start looking fake and phony and deformed. So you don't want to do that. So another very important question that people ask me, and some of the things that I've already made my comments very clear, is the use of some of these anti-aging medications. Because I understand you guys may have heard about a lot of different treatments, like you may have heard of injectables, and the injectable medications are different names and different brands, and they do different things. So there are some injectables that will allow us to relax your muscles, and there are some medications that when we inject allow us to repair the damage that is caused under the skin when you lose your collagen as you age. So there are different kinds of medications. So if you look at the muscle relaxers in United States that are currently being used, there are like around 4 or 5 different kinds of products. And then we also, some of the other medications that are currently under use as hyaluronic acid fillers are like around 17 to 21 different kinds of FDA approved medications that are currently available in the market in United States. Now the thing is that people will tell you that some work better than the others, which ones are the ones that I will never recommend using. And I basically tell all injectors to try out all of them, but there are some that are my favorites. And what is that magical place where like if you stay below that magical place, you're not gonna get into trouble, you're not gonna get into deforming intentionally or unintentionally any person. So that is something that I train people. I have currently courses that are being taught to doctors, nurse practitioners, and physician assistants, where we will train you how not to utilize some of these medications. Because remember, when you do these courses to inject your patients, just remember that initially when you start buying product, the companies usually tell you to use a lot of them, and sometimes using a lot of this product, because you have to purchase it and then you dispense it. The understanding is now evolving that how not to inject too much in a person's face over a period of time, because that's when people start looking fake and phony and deformed. So you don't want to do that.